Hey everyone, I'm Instructor Brooks and I'm a physical therapy educator. And in this video, I'm going to talk about tidal volume. So if you're ready to learn something, let's go. All right, guys, so tidal volume, part of the spirogram, super important when it comes to physical therapy. We have to know this because of its respect to pathology and exercise, and you got to know it for the boards. So let's take a look at the most important part, which is tidal volume. If you don't understand tidal volume, you're not going to get the rest of it. That's why this video is solely dedicated to tidal volume. So you'll see here, I've labeled 3 different sections. Each have a different color. You got red, black, and green. So all of this is tidal volume. And tidal volume is simply the movement of air in and out of the lungs without forcing anything in or out. This is what's called the resting state of your breathing. When you're taking someone's respiratory rate, this is actually what you're taking. This right here. The black one, respiratory rate, right here, the normal breathing. What you're doing, watching this video, just sitting there, breathing or standing or walking, that is your normal tidal volume. So the green part represents what should happen with exercise to the tidal volume. And you'll notice it's expanding up and down. You should have larger inhales and exhales. If you were to be walking and start to go on an incline, you would definitely notice this change if you're healthy. So that's what needs to happen with exercise. If this is not happening with exercise, we're going to notice a few things. One, the patient is going to probably fatigue. But how could we measure this without actually measuring the volume? Oxygen saturation rates. Since they're not moving oxygen or air in and out of the lungs, they're not bringing oxygen in at a rate that they need. So they're going to overuse oxygen, thus their oxygen saturation rates are going to decrease. Also, since they're not breathing enough, if they're not doing this with exercise, they're going to start to have an increase of CO2 buildup in the body. Anytime CO2 increases, acidity increases. And when acidity increases, the pH goes down. And when the pH goes down due to a problem with breathing, I believe that's called respiratory acidosis. So this should happen with exercise if you're healthy. If you're not healthy, then we look at the red one. Or maybe not healthy, but maybe you're on bed rest, or there's a lot of reasons why you might not be moving around as much and using your system. So let's say you have a certain pathology or you have bed rest, but you're not. Maybe you've been lethargic, or maybe your patient's been lethargic. So their tidal volume will be shrunk. They actually might have a higher resting respiratory rate because they have to breathe faster to move enough air in and out, but they're not taking deep breaths. So all the reasons I said that the larger tidal volume, if it's not getting larger, all the things that would happen, like reduced oxygen saturation rates, you may see here as well, but this might be your patient that's actually on like oxygen, like through the nose, okay? But this problem here, because you're not moving much air, makes the patient very susceptible to everything I already talked about and pneumonia. And that is a huge problem because that leads to death. So this is why patients need to get up and exercise, and we need to be monitoring those oxygen levels so that we know what's happening with their breathing and how effective their cardiopulmonary system is working. Once you understand this, and the way I would do it is literally drawing this out and explaining it to your instructor so that they can see if you know it. Once you can do that like I just did without any notes, then you have a basic idea of it, and hopefully you can remember it. And then you can start adding in all the other aspects of the spirogram, which I'll have other videos for in a playlist about the spirogram. So if you want to get access to more videos that aren't free like this one, then join my YouTube channel at the student level and you get access to a ton more videos. But if you just want to keep getting free videos, then hit that subscribe button, click the bell for notifications. That way you don't miss any of my videos. And if you learn something, hit that thumbs up button. And with that being said, go out there, be nice, catch you in the next video.